Hello, everyone. It's Dr. Jeff Lewis here. I've been in private practice for almost 25 years and have yet to fully realize the opportunity that nutraceuticals can provide for our patients and our practices. The reality is that all of us recommend products to our patients daily as part of our normal course of action, whether we're talking about AREDs, lid scrubs, fish oil, over-the-counter drops. We are already naturally recommending products, but we're rarely the beneficiaries of these recommendations. And compliance with our patients is a real problem. So, on behalf of fellow colleagues who may also be contemplating this for the first time or have been thinking about implementing a win-win program, a win for the patient, a win for the practice, it's an honor to have Dr. Lee Ford with us today to show us how he has successfully incorporated and monetized a successful supplement program into his private practice for his patients. The reality is that his patients are more compliant than many of ours, and that the profit his practice is seeing from nutraceuticals in a month beats what most practices do in a year. And Dr. Ford has had success with a patient population where you might expect to find more resistance. Dr. Ford, thank you so much for your willingness to share what you've learned and the protocols you use in your approach to this. And I'll let you take it from here.
Well, thank you for having me. Yeah, we are a little bit, I'd say, in the country, as you would put it. We're in the middle of Mississippi and one of the poorest counties of the state. And we don't get as much pushback as you would think. We teach patients. I've always found that you don't sell, you tell. And when you tell people and you show them, they respond. And we have had real good success with the Doctor Portal from Lunovus because it's just simple. It makes life easy. With the pandemic, especially, it's really been easy. A lot of my patients are older. They're not interested in going to Walmart or Walgreens. So having what they need show up at the front door is very beneficial. We use the tracking system so I know who goes in, who made orders. I know who's dropped off, and we reach back out to them. My staff has been trained to run the portal, and it works very efficiently. We've been very, very pleased with it. Like you mentioned earlier, we're already doing this in our office. I did this for years. I used to be in a Walmart, and I would tell them, "I'll just run over to the pharmacy and grab this and this and this," never thinking that I could give a higher quality product, simpler for the patient, and better for my bottom line, all combined. And that's what we found with the patient portal from Lunovus. It's worked really good on all three of those key points. I want to thank Lunovus for allowing me to speak and kind of tell our story. If we can be successful where we are, you can be successful anywhere. I practice in Columbus, Mississippi, which we're in the great state of Mississippi, and that is a misnomer because we're usually at the bottom of the heap when it comes to annual incomes, and a lot of times you would think patients would have a hard time with supplement use and or other things of that nature, but you'd be wrong. If you take the opportunity to tell your patient when you're in the chair, I've found, at least in Mississippi, that we've had a lot of success. If you take a minute to show a patient through your slit lamp camera Demodex, they're going to want to get the foam and the wipes to get it off and the scrubs. If you show a patient the tear breakup that's a very bad TBT, they're going to want to do something to get that better. If you show them their macular degeneration, their dark adapt score, their ERGs, you show them visual field, they're going to want to do AREDs too, plus meso. And we have been very blessed to have the folks from Lunovus help us with this. I like this approach, especially during the pandemic. It's really been good for our office. A lot of my patients are older. They have a hard time getting out, or they just flat don't want to get out. The Doctor Home portal's been great. It allows me every day to see I prescribed 10, for example, and 3 people filled it. Well, the other 7, we marked their record that they didn't. And it kind of lets us know when they come back, if they're not doing so good, here's why. If they do fill it and they drop off, we'll notice that the next couple of days. If they after they've dropped off, and it really helps us to keep, if you send your patient to the store to buy something, you don't know if they bought it. You send them to the Doctor Home portal, you know when they bought it, you know when they received it, and you know if they're using it, unless they come in and say, well, I've got 5 bottles of that. Then you have a discussion about what they're not doing correctly. So we've had good success with this. We're already doing it. I mean, it's, like my little quote says, you're already doing it. Why not do it better for your patients and your practice? The Doctor Home portal has been very profitable for my office, doing something that I already do and that you already do. I want to thank Lunovus for allowing me to do this presentation. It's been a lot of fun, new experience for me. A lot of technical things that I haven't done before, like the Zoom and the different recordings and things, and it's been an entertaining process. So thank you. Let's begin. 3 keys to success for recommending OTC vision supplements. And as I said before, you're already doing it. Why not do it better for both your patients and your practice? I'm Lee Ford. I'm an SCO grad. I'm undergrad at Mississippi State. Been out of SCO for 21 on 22 years, coming up real soon. Lived in Millport, Alabama, with my family. You'll see the little guy in blue. That's Henry. Beautiful lady, that's Rose, and that little monster in red, that's Donovan. All I'm trying to do is keep him from taking over the world. That's pretty much what we're trying to do. He's kind of dangerous. So as you'll notice right here, yes, you do see a Walmart Vision Center. That's where I started this process. And yes, I do work in a Pizza Hut. I purchased the Pizza Hut and I painted it blue. It's very easy to find the big blue Pizza Hut. So we just send our patients down the road to that when we need to find out where we are. We look at the city revenue. Our median average income in Columbus, Mississippi is about half of the annual income. Here's our supplement sales that we did, broken down by quarter. Uh, you know, it was surprising. We started off and we didn't do too much, but it started to pick up. And as it picked up, what we saw is the patients that came back for the repeat, that refilled their prescription. We'll have a slide in a minute that shows the percentage. Not everybody gets this. Some of them just don't. Some of them won't. Some don't care. But the ones that you do show them these important things, they catch it and they get it. And they understand. So, our revenue has grown fairly well to match the sales. It was kind of a little bit of a surprise. As it grows, it's kind of fun to watch that because you're already discussing this with your patients. It's nice to actually get paid for your time. And what do we recommend for? Well, what I recommend for in my office is Demodex, blepharitis, dry eye MGD, and ARMD. Those are the 3 biggies for us. We have a lot of Demodex. I don't know about y'all, but I have probably seen 8 or 9 in my career prior to masking, and I bet you I see 4 or 5 a day. Nothing helps a patient who's had dry eye symptoms and issues better than flipping that slit lamp camera on and showing them a nice set of eyelids full of cylindrical dandruff. And when you flip over to Google and say Demodex lashes, man, that makes a believer out of them. They'll do what you need them to do. The dry eye and MGD dysfunction, we use a Topcon CA800. It's a topo, but it has a real cool extra add-on to it that allows us to do tear breakup time and dynamically. And it also, we can invert the lid and get a good mybography image. That kind of explains itself as well. ARMD, again, we use technology to help us explain to our patients what's normal and where they are. When you flip that OCT up, we use a Maestro. We screen all of our patients as they come in for their annual check. When you show that patient the drusen and you show them the dysfunction of the inner retina, and you show them some images again off Google, we just do ARMD, you'll search on that. It really brings home, what we're explaining. So again, I found that we don't sell, we tell. It sells itself. I'm not into making sales. I'm into making patients comfortable, happy, and healthy. And I found that this works well for me. As I alluded to earlier, we do not get 100% compliance. We don't see 100% of the patients that Dr. Ford prescribes for sign up for the portal. There's a plethora of reasons. I'll come back and pick it up. I don't have the money. I don't want to do it. That's fine. But I see, roughly 20 patients a day. 7 of them, we went and pulled my numbers for a couple of quarters and looked at who I'd recommended to, and then checked our portal logins and our signups. And we're prescribing to about 7 patients a day on average, which I actually thought it would be a little bit more, but it wasn't. So 7 per day. And of that 7, we're getting about a 34.7% who pick up the product recommendation. So about 2.5 out of 7, or about a third. And with that third of those patients, real simple, you're already doing it. So why not do something that's better for your patient? Why not do something that's better for your income? And where we've had success with that is, as I said before, the Doctor Home program. When I sign up from a Doctor Home program and have a patient sign up, I get a report the next day that shows me how many patients we had sign up for the portal, tells me what they signed up for in the portal, and it also gives me a list of patients that have dropped off. Either their card went off, they weren't being able to be reached for authorization, or they just didn't want to do it. And I have my staff reach back out to those patients, and we'll touch base with them. So, Ms. Jones, why are you off of the program? And that kind of helps, and we keep that in their record. So no other supplementation or drops or excuse me, I'm sorry, hiccup. Uh, no other supplement process or product is going to allow you to know what your patients are actually purchasing other than Dr. Home that I know of. And it's worked real good for us. And on my daily average, we kind of went back and pulled some of my data over the last couple of quarters. And we found that we see on average, some days more, some days less, about 20 patients a day. Of those 20 patients, 7 patients receive a recommendation. And a recommendation does not mean that they are getting the product. It just means I said Miss Smith needs X because of Y. And my staff takes that to the Doctor Home portal, and they will sign the patients up that allow us. We don't have 100% compliance. I would like it, but not everybody wants to do that. Some people get up to the portal, get up to the checkout, and they don't want to sign up for the portal for whatever reason, and that's fine. I was kind of surprised to see that my compliance rate was only 35%. I thought it would have. That's 35% of my total patients. About 2.5 out of 7, so about 2.5 patients a day. I thought it was better than that, but hey, it is what it is. And again, the only way I'm able to tell this is Doctor Home portal. That portal gives us a great uh, printout. They email me every afternoon. I get it in the morning when I come in, and I take a look at it. And it shows who we signed up the day before. I also shows who dropped off the night last night, which my patients will then be reached out to by my staff to see what was the reason they dropped off. And we get a lot of them that sign back up because they dropped off in error. Oh, I thought I didn't need it anymore. Or, oh, my credit card canceled. My little number was off. All kind of little reasons, but we give them a call back and we put it in their record that we spoke to them. And if we don't get compliance, it has a reason why when they show up next time, they're not doing so good. And then we show that to them and they're like, oh, okay, I get it now. And then we'll do a little bit better the next time. So very happy with the Dr. Home portal and being able to track patients, which is a big thing for me because nowhere else that I've dealt with are you able to actually see if your patients are actually doing what you ask them to. This is the first place that I've had to do that. And why is that important? Because, doc, you're already doing it. I mean, you're already prescribing to your patients. All of us do. Why not do it better? Make it better for them. You can keep up with it better. You know what they're doing. You know if they're doing what they're supposed to do. And it's better for you. Win-win for everybody. So the key to success with what we've been finding is subscriptions. And let me tell you, it's a beautiful thing when you check your numbers. So subscriptions drive compliance. And this right here is the number of active patients on subscriptions we have, 217, and active patients on 2 products. That would be, for example, wipes, and foam. Keys for success in my office are subscriptions. Being able to track a patient, are they doing what you asked them to? Are they getting the prescription filled? Are they using the product? And that's what we've used the Doctor Home system with a lot of success. We flip over here, and these are statistics from my office. Now, I've had it less than a year, but the findings are pretty impressive. 217 active patients, 95 on multiple subscriptions. That's AREDS 2 plus artificial tears, or Blefadex foam, Blefadex wipes, artificial tears. That'd be 3-in-1. That happens all the time. And we keep our patients on average 6.9 months, which is a lot better than the industry standard. I'll show you in a minute. So if 40 patients buy a product in a month and you got your $20 MSRP, your standard, you get $800 of revenue from those 40 patients. That's a one and done, okay? That's not how this works. So what I'm getting from my office is compliance with growth. Here's how it works. 40 patients buy, $20 average per month, 800, one and done. But that's not how ours works. We get the repeat because we're averaging 6.9 months, not a 1 month, 6.9 months of the patient staying on the prescription. Now, a little caveat, the 6.9 months was prior to me having my staff reach out to patients. So I'm really excited to see how our next year looks and what our statistics are there with my staff making calls and emails and texts about patients dropping off the program. And you can see the difference in revenue. The one and done model, this is kind of our compliance driver. Again, I'll go back to the portal. It does great for us because we're able to keep up with what's happening. You got your 40 patients, $20 MSRP. That's 1 month, okay? The industry standard is like 2.2 or 2.3 months. But with our portal, the Doctor Home portal, we get 6.9 months. Now, that is with me not calling the patients and having the staff call them back. I'm really excited to see our numbers next year and see what our growth is. So instead of an $800 revenue, 6.9 months, that's a little bit better revenue in my eyes. And that's just that 1 month, because we now have the next month that adds on, and then the next month. So it keeps growing. It's a good thing. It's nice to look at that portal and see your numbers. So your lifetime value of each patient, as we reach out to patients, as we touch base with them, we're going to drive more eye exams, drive more eyewear. You're top of mind with people. They're going to remember that their contacts need filling. They're going to know that, hey, I missed that visual fields. And hey, we're interested in Ortho K because I do a lot of other marketing as well. So keeping these patients in contact where you're taking care of them, it pays off. You take care of your patients, you tell them what to do and tell them the right thing, it works well. One of the big ones in my office, as I told you before, is Demodex. With the pandemic, we are seeing a lot of it. If you are not looking at the lids with a high magnification and flipping your little iPhone out and taking a picture, you're missing some stuff. So you may say, well, I don't have a slit lamp camera. Don't need one. These are actual images that I took from my iPhone. That's my iPhone up there. That I took some pictures of the patient's lids. You don't have to get, wild and woolly with it. You can do it with a handheld phone, and then drop it to your desktop and upload it to your EMR. Patients have a strong aversion to bugs in their eyelashes. I know it sounds kind of wild, but you show that picture to them and they become instantly alert on how to get rid of the itching that they now understand where it's coming from, and the little crusting in the dandruff. It works really, really well. It's a self-explanatory problem. So in my office, I did things a little bit different. We see our BluffX over there on the left, $70 expense for the brushes. And again, remember I told you I'm in Mississippi, we poke. So we found some interesting ways to beat that problem. The little pink, blue, and clear finger scrubbers that you see right there are actually from Amazon, and those are children's toothbrushes, but they work wonders on the eyelashes when you're exfoliating. They're awesome. Uh, the far right one, the little brushes, are from Amazon as well, and they're 6 cents a piece. And we use that as part of our exfoliation when we're treating our patients. The way that I treat my patients in Demodex is I'll have them come in and we do a Marco Epi-C, the Epic. We will do a blue light blue light treatment on them, followed by Blephadex foam to the lids. We'll let that foam do the scrubbing bubbles. You know, they work hard so we don't have to. And then we will apply that little white brush with the black tip and scrub them off. And patients are very happy. They don't have to spend $70 to have treatment. They can spend 6 cents, and we just kind of make it part of the process. We follow up with the wipes every night. The Manuka honey is great. That's one of the newer products that we have from Blephadex. We've had real good results with that on blepharitis and Demodex. And then we'll use the foam in the morning, the finger scrubbers in the morning. And it's worked really, really well. So in my office, the way that we deal with Demodex is our ultimate bug blaster pack. And what we have with that, we start, like I said from the slide before, we will actually have the patient come in and we'll do a blue light, which is from the Marco Epic. The LLT for the blue face mask works wonders, 15 minutes behind that. And then we will apply the foam to the eyelid margins and give them a few minutes and let the scrubbing bubbles work hard so we don't have to. We'll then use our little mascara wands and we will scrub a dub till all the bugs come off. And when I'm done with that, I hand the patient a little bag that my staff has put together, and that's our bug blaster pack. And what it consists of is we'll have a box of wipes. The Blephadex Pro is the newer version of the wipes. It's got the Manuka honey, wonderful for bacterial suppression on the lid margins. It works great. We'll do that every night before bed. I'll show the patient how to use the wipes. We'll also show them what to do with the foam, and they will do the foam in the mornings. They'll give a couple of squirts to each side of the eye, nasal canthus area, let it settle across, give it about 5 to 7 minutes, and whip that little kid's toothbrush, lid exfoliating brush out and clean the lid margins every morning. We've had great success with that on having that under control with just those two simple little things. It's worked really, really well. And it's not a financial burden to my patients. Again, remember, we're in Mississippi and folks around here are poor. We can't afford $400 for treatments. We can afford 60, and they do that and don't have a problem with it. We do that through the portal, the Dr. Home portal, and we set them up for that and get them taken care of. And it's worked really, really well. So the next thing we're going to talk about is dry eye, one of my favorites. Dry eye and MGD. This has been something that is near and dear to my heart. I myself have a pretty bad case of dry eye. I didn't realize how bad it was until I actually got a look at it. We use the Topcon CA800. It is a topography system. It's good for screening for keratoconus. It's also great for screening for dry eye. It has a component of it where we get the meibomian glands and we get the tear breakup. We also use, as you can see, the tear lab for osmolarity. And in the background back there, that's the Marco Epic, or Epi-C, however they want to pronounce it. I've heard it different at different times. And that right there is what we use for the blue light and the red light, which is wonderful for photobiomodulation and MGD and dry eye. We also use a very simple speed questionnaire. We do that. My staff does that before I come in. When I come in, what I'm looking at is this right here. This shows us the patient's eye. So we've got Mr. Smith, and Mr. Smith is not looking too good. What do you mean, Doc? Well, what I mean is this is what you're supposed to look like. Notice where it starts right here, and it runs all the way back to the crease. That's a normal eye. Here's where you are. See where you have the dropout? That's not a good thing. So we're going to start helping you with that. and I'll show you our treatment protocol. So we show them where they are, where they should be, and then we move on to the tear breakup. So tear breakup to me is the thing that really explains things to patients. Like I said, I use a CA800 TopCon, and this is part of their little package. It takes about a minute and a half for my techs to get all this. It's real simple. It's just part of our protocol. And when you're able to take this patient in and show them their actual eye that they see, that's my eye. Yes, ma'am, it is. And Miss Jones, what you're supposed to see is a green layer across the top. Should last about 8 to 10 seconds. You run that test and it breaks up in less than a second or 2 seconds, as this one shows. This is why you're blinking a lot. This is why you're having dry eye trouble. And I am an extremely ardent supporter of dry eye, because some of you younger docs on here won't know my man Si, but us old folks, I'm not only the dry eye president, I'm a client. So this is my eye. As you can tell on my eye, I don't have much left here. So I'm having issues with it. So I can empathize with you, Miss Jones. I feel the same thing you do. And let me show you how I've taken care of mine. These are some things that have worked well for me. We use our non-preserved artificial tears, which are wonderful. They feel great. Here, let me give you one. Drop, drop, put it in the eye. Patients love that. They actually, oh, this feels wonderful. Yes, ma'am, it does. And that's just the very first one. We also use our Tear Support Plus. It works great. I'm more for the Tear Support Plus. Some people do the Tear Support, but I like the big boy. It's good. I use it myself. Like I said, not only am I the dry eye president, I'm also a client, and it works really well for me. These are what I have. So over here, we'll look at our consumables and our margins. Again, don't have to sell things. Just tell patients things. Let them try them out. They love it. You make $5 off your artificial tears. I was making nothing off all the ones that I did when I was practicing prior to Dr. Home. I didn't get anything for it. Just told them to go pick it up wherever. Uh, you got your Tear Support Plus. You spend 18, we sell it for 30. It's $12. That's a nice $144 a year, little bump that you don't have to do anything for except have a very happy patient when they use it. Again, I've used it. It works well. And the one of the neat things about Lunovus, they got a 90-day, no questions asked. If your patient's not happy, they'll refund you. Can't beat that. Once you put a patient in it for 90 days, buddy, they ain't going to argue with you. They love it. I've had a real good response with that. And again, that's in an extremely impoverished area. If you're in a more affluent area, this is going to be an easy win for your patients and your practice. Next thing we do is ARMD. ARMD, again, not only am I the president, but I'm also a client. I have a dark adapt that's kind of off. My grandfather lost an eye from it, and my father has ARMD, very mild. So I'm treating myself. So what I offer my patients, I'm taking myself. We use a Maestro. We screen all of our patients, and we use a dark adapt to also show a screening of what's normal. A normal patient should be under 6.5 minutes. And no, ma'am, you should not have these big drusen in this big blood spot. So it kind of speaks for itself. It's self-explanatory. Healthy, not healthy. And here's what we do about it. This is the beginning. This is part of our protocol. We use the AREDS 2 plus Meso Z. It's a good little margins, $27 we sell it for, delivered to the house. And patients do not have a problem with that. Yes, you can get a less expensive one, but I'll tell you this, the bioavailability of this product has worked wonders for me. I also do contrast sensitivity, and I have in my own practice, I have had patients' contrast sensitivity improve dramatically in 3 months. This is just an anecdotal discussion, but when you catch it early, you can reverse it, not reverse it. When you catch this problem early, you're able to make a much bigger dent in the patient's well-being and do a lot better. It's easier to fix something early on than it is when it's further down the road. And this works very well. I've had good response with it. So part of my treatment protocol, along with, hats, proper diet, no smoking, is our AREDS 2 uh, supplements, and the AREDS 2 plus the Meso Z complex with the lutein, zeaxanthin, and mesozeaxanthin is our latest and greatest. We've had real good anecdotal uh, responses. I'm a firm believer in early. Find the problem early, deal with it. You make a bigger impact. Um, I have had anecdotally in my office patients. We also run contrast sensitivity, and I've had patients who have bombed contrast sensitivity 3 months on the AREDS 2 plus meso come back and be dramatically improved. Not everyone, but a good bit of them. So I've been very happy with this product. It's worked well. Oh, another thing that's interesting, they don't just have the pills. They do actually have different gummies and things like that if patients have a hard time swallowing. Some of my patients are a little older and they have a tough time swallowing a big pill, so we have some gummies for them. So that's been very useful. You'll find that on the Dr. Home portal as well. So kind of wrap it up for me, course to success. In my office, I don't sell, I tell. I just talk to the patients, show them what's going on. What do we show them? Technology. Let them see, show them normal, show them where they are. They'll get it, they'll understand. And then we leverage the subscriptions to get better compliance. Again, Dr. Home portals work great. It's able to do tracking, it's able to keep up with what's happening. Not only that, but I actually get paid for the time that I take. Time is money in our office. If I'm in that office explaining to you why you need to use this product, in the past, made nothing for that. That's just a write off of time. And as we saw, 3 patients a day accept it, but I'm doing that 7 times a day. That is that's a 5 minute a patient. That's 2 exam slots that we could have slid in there, 2 20-minute slots. So it's nice to be compensated for your time. I have nothing but good results that we've had with this product. Our patients have had a good response, and I've had a good response. So it's been a pleasure working with them, and I would encourage you to reach out to the representative in your area, have a talk with them, see if it works for you. Thank you very much for your time. It has been a pleasure. So keys to success for my office have been: don't sell. I don't sell anything. I just tell. I show my patients what is normal and where you are, why you need this. And we use technology to do that. It is self-explanatory when you do it that way. We have been able to use that technology, and we have been able to leverage Lunovus's technology through the Dr. Home program to be able to track our patients, to actually know, are they getting what we ask them to? And if they drop off of what I've prescribed them, I get notified and we reach back out to them. It's a great process. Again, I would encourage you to reach out to your Lunovus rep and ask them to come by and talk to you about it. You don't realize how improved this makes your patient care till you try it. Again, not only am I the president of the Dry Eye and ARMD Society in my office, I'm also a client. So it's worked well for me, and I've been very happy with Lunovus, and they've been great to work with. So again, I would like to thank Lunovus for having me on. It's been a pleasure, and I hope you have a wonderful day, and I hope your practices grow and you take care of your patients. Thank you.
Lee, thank you very much for that. That was very informative. I really appreciate it. I just have a few questions, if you don't mind. One is, how much time would you say is required, of the staff in terms of implementing, a program like this for a patient?
That's an excellent question. And we tried it the original way, which was we had a pad, had our name on it, had the website, and uh, unfortunately, over here where the internet could consist of two tin cans and a string, that has not worked very well. We got more phone calls of, I can't get it hooked up. Something's not right. We were spending a lot of time trying to help patients walk through a very simple process. So what we do is we actually sign them up on the spot. It just makes it easier. It's simple, nothing to it. My staff takes about 2 minutes as part of the checkout process. And it's just, I see Miss Jones, Dr. Ford has prescribed you ABC. We'll be signing you up on the portal. Let me see your card. Thank you. Boop, run it through. Here's your free box. You're good to go. Have a wonderful day. Very simple.
Lee, do you find a lot of pushback for patients signing up for prescriptions?
Surprisingly, no. The patients that are wanting to take care of themselves, we haven't had an issue with it. They're pretty quick to sign up. Staff doesn't have a big problem with it. They've been well trained by our Lunovus rep. They came in, they taught them how to answer no with a good response that a lot of times turns the no into yes. And we've been very pleased with it.
Perfect, perfect. Another question, you'd mentioned compliance, and with a program, do you feel like a program like Doc to Home helps with compliance overall?
100%. Again, where else are you going to know that your patients are on meds? That they're taking what you've prescribed them. You're just not. And like I said, I get a report every morning and it shows me who signed up from the day before. It shows me who dropped off from the day before, from previous patients that were signed up. We cross-reference the sign up with who I had to sign up. And if there are any patients that I really, the ARMD patient that I'm concerned about, Dr. Ford, they just said they didn't want to do it. I'll call them. I'll reach out and say, hey, Bob, look, we talked about this. This is important. You need to do it. Note it in the record. And then we'll come back and test them and see how they're doing with contrast sensitivity or dark adapt down the road. And like I said, the early detection is what's been the driver because I can show improvement. I can have that dark adapt score improve. I can have that contrast sensitivity score improve. It's worked well. I like it.
And another question regarding Doc to Home, how initially, like in the very beginning, how hard was it to get set up to integrate the program in the practice?
As you know, old folks take a little while to change how they do things. So the biggest problem was me to sit there and have a discussion with the patient about the process of what we needed to do. In the past, I had just handed that off. Get them some drops. This is what we need to do. Da da da, and out they went. But now I take a minute. Like I said, the Novus rep really helped me understand the importance of that. And it worked well. I've got a good relationship with the young man that I work with, and it was different, but old dogs can learn new tricks. And it's been great for my patients. And that's what I'm here for. And not only that, but it's nice to have a little paycheck for the time that I spend.
Why did you choose Lenovis products for your patients in the beginning?
Well, I've had several different companies that I've used, a little bit here, a little bit there, but nobody really took the time to explain, how to use the products, what to do, how to leverage it for my office. The rep that I met from Lenovis was great. The guy took time, spent some time, took no for an answer when I didn't see him the first time, and he came back and we had a good relationship. And I've had, that they're ethical people, and I have no problem with that. Again, they understand that I tell, not sell. Wasn't a hard push, just a discussion, and I have no problem with that. And so I like to learn. Sometimes I don't have time, but the man was persistent, and they have good products. It works, and nobody else I've dealt with has the Doctor Home program, which lets me track my patients. That has been the game changer for what we do, for quality, for outcome.
So, Lee, you mentioned partnering with Lunovus. Do they require that you stock inventory?
Not at all. That's how we started off. We didn't stock inventory. I like having it on hand. I like to be able to put it in their hand immediately. when I sign them up. If it's important enough for me to talk about, I want them to have it when they leave. So it's worked very well for us.
Great, thank you. Lee, overall, how would you say this has exceeded your expectations in terms of, growing the practice?
It's been nice. Uh, Again, I'm doing it already. I was already prescribing. I was already telling patients what to do, what to get. With this, I have a revenue stream. Not only the revenue stream, that's nice, but more importantly, I actually understand why people are getting better or staying stable and why people aren't getting better or not staying stable. And then I can use that tool to leverage patient compliance. The subscription program from Lunovus on Dr. Home has been great. Nowhere else have I been able to keep up. I don't even know if anybody else does that. I've never heard of it before. That was one of the key drivers. I was like, that's pretty cool. And it is. It's worked really well for me.
And then, this last question is somewhat related to what you just said, and I think kind of dovetails a little bit with a slide that you went over. But the question is, how does this program relate to other things that you do in the practice to drive revenue outside of, the traditional model that we're all familiar with?
Well, again, anytime that you're able to reach out to a patient and show them that you care, even if it's to call them and ask, why are you stopping taking the drop? Oh, I wanted to get it over here. Okay. It at least shows that you care. When you show that you care, people, they feel that. And I like that. That's one of the things that I enjoy doing because I do care. I do care that Miss Smith is getting her drops because when her tear breakup is 1 second and she can't wear her contacts, I can't fit her in contacts. We can't keep going. It's uncomfortable. So having a way to track this and show these patients if you do what you're supposed to, oddly enough, things get better, has been wonderful. It works great. We've been real pleased with it.
Great, thank you. And Dr. Ford, again, thank you so much for sharing this with us. It's been very insightful, and I know that this will be extremely valuable in helping our fellow colleagues understand both the potential and reality of this opportunity. I really appreciate it.
You're very welcome. It's been a pleasure.